Hi everybody, my name is Sandra. Welcome to your practice. This is going to be a short and mellow prenatal class where we're going to focus on mobilizing and bringing ease and relief to the lower back and the hip area, both areas of which tend to, where we often feel tense, unstable, and maybe also a little bit fragile during pregnancy. So what you need for the practice is preferably 2 blocks or something of similar shape, together with 1 or 2 blankets. So we begin the practice in a seated position, cross-legged, and if you notice that your knees are way higher than your hips are, you want to raise your seat and sit on a block or a folded blanket, whatever you have close by. And have your hands rest on your knees or thighs. Allow your eyes to fall closed and give yourself just a few moments to arrive on the mat. Guiding your attention a little bit more carefully to the breath. How it comes and goes at the tip of your nose. From where we guide it a little bit deeper down into the abdomen. Quietly inviting your baby to join the practice. Feeling the sit bones ground, which is your foundation from where you're growing high towards the sky, with your shoulders relaxing away from your ears, and the crown of your head reaching high. And we'll slowly open your eyes again. And we'll begin the class by mobilizing the whole spine. We make some organic sweeping movements with our arm and our spine. So have a look. You want to reach your right arm far over to the side as if you wanted to collect some air, and then sweep your arm to the front and over to the left. And then above your head, behind you in a sort of twist. And then place your hand back onto your knee or thigh. Take a deep inhale. Reach your left arm over to the left. Collect some air. Sweep to the front, to the right. And then a little bit behind you above the head. Spiraling your chest up in a sort of spinal twist before you rest your hand back onto the knee. Reach over on your inhale. And then exhale. Sweep to the front and to the left. Lift your heart. And let's do that a few more times in your own breathing rhythm. And making this movement really juicy and organic. Synchronizing the movement with your breath in a way that makes sense to you. But trying to mobilize the spine and the shoulder girdle here. There are no fixed rules really, so be inquisitive and open to explore. So 1 more time on each side. Big, generous movements. And once you've finished your rounds, we want to meet with our feet in front of us, and probably you're not going to need anything to sit up on anymore. So you lean a little bit back onto your hands, and depending on the size of your belly, your feet need to be further away from your sit bones, or they can be closer. But have your feet relatively wide, so to accommodate the space your belly needs. And then place your right ankle on top of your left knee. Flex the right foot and spread those toes wide. Roll the shoulders back. As you push your hands into the floor, observe on how you roll a little bit more towards the top of your sit bones. So we re-articulate the lumbar arch to get a little bit more precisely into our hip flexor. So we want to make hip rotator muscles, So we want to make sure that we're not rounding the lower back. Also lift your heart and take a few cycles of breath here. Before you place your right foot back onto the floor, and changing sides. So bring the left ankle on top of your right knee, flex the left foot, spread the toes wide if you can, so you can feel the air in between your toes. And now you're pressing your hands down into the floor, and that helps you to roll forward towards the tops of your sit bones, which you will probably feel then a response in your left outer hip. Lifting your heart, and make sure you encourage deep breathing up to the tops of your lungs, so you spread the collarbones wide. And then place your both feet back onto the floor in front of you. Have the feet relatively wide again. Place your hands behind you. The fingertips can point back or just slightly out to the sides, whatever works for you. But lift your heart, so again, don't slump down your spine. And then just very easy, very simple, we're just dropping the knees, the legs from one side to the other. So this is a really gentle hip mobilization. It shouldn't be too intense, really. Just very easy, very gently. And then from here, continue, but we're gonna meet with our knees falling over to the right side. And then you roll the left hip point a little bit into a tiny twist to the right, so the left hip point is lifting. And you now get hold of the top of your left foot. And you guide that left knee a little bit further back now, so you separate your inner thighs. And now you're holding the top of that left foot and continue rolling that left hip point forward. So that should throw the stretch a little bit more precisely into your left hip flexor. As you roll that right shoulder back, you can come on those right fingertips. This is a very mellow twist as well, so not a really deep one. Now breathe deeply, continue to allow the breath to wash through the body. Before we come slowly all the way back to center, place your feet back in front of you, and then roll your knees over to the left. And then you need to guide that left knee further back, so you separate your inner thighs more from one another. Getting hold of the top of the right heel, ankle, and then pulling that ankle a bit more closely to the sit bones, depending on your range of motion. But you now need to encourage that right hip point lift and to roll forward into a gentle twist over to the left. This is probably enough to get some sort of sensational response in your right hip flexor. Breathing deeply into it. Lifting your heart. And broadening the collarbones, so making sure we encourage breathing space in the upper chest. And then from here, come slowly back to the front, and then swing your legs just back. So we meet in a tabletop position. Can be nice to have your knees rest on the blanket. See what works for you. Hands underneath your shoulders and knees underneath the hips, spreading the fingers wide. And then let's do a few cat and cow. So rounding the spine, tailbone dropping, head dropping. On the exhale and on the inhale, lifting your heart in cow pose. Roll those shoulders back. On the exhale, round the spine, head drops. On the inhale, lift your heart, lifting the sit bones, shoulders roll back. Just continue a few cycles on your own breath, and you will notice the bigger your belly gets, the less you will have the pelvis tilt available. So the more, that means the more the curvature really occurs in the upper back. So you concentrate more on mobilizing the upper back and keep the curvature a little bit less in the lower back. Just see what works well for you. So let's meet in a neutral shape, neutral table. And then take your right arm and dive it deep down underneath to the left, reaching as far as you can with your right palm facing up. And then slide your left hand maybe a little bit further back, so it's pushing down in front of your face, so you can see that hand. Gently pushing down and helping yourself more into a twist to the left. Your left elbow is pointing high. And you should have almost no weight on your head. So most of the weight is resting on that right shoulder. And if this is not available, then push that hand more down. So you have more weight on the hand, on your left hand then. Inhale, come back to upright. And then do the same thing to the opposite side. So your left arm dives deep down, underneath, to the right with the palm facing up. And then your right hand is in front of you, pushing down into the floor in front of your face. Helping yourself a little bit more into the twist to the right side. And the deeper you dive down, the further you dive down, the more you feel an opening stretch in between the shoulder blade and the spine. On your inhale, come then back to upright. And now we want to use the blocks. So we want to come into child's pose with our arms being really extended, opening the knees wider than usual to accommodate the belly, and our arms resting on the blocks. Make sure your hands are shoulder width apart. Let your forehead maybe drape down onto the floor, if the floor is within reach. And make sure your arms are really, really straight. So your elbows are straight, and you want to push your hands into the block, preparing for the wave. So you take a deep inhale here, and on your exhale, round your spine forward, come onto your knees and hands in a cat pose manner, rolling forward, head is heavy. And at the very top, imagine your body wave would hit the shore, lift your heart. Now, the navel can sink down in this upward facing dog variation, but if this feels like too much of a stretch in the tummy, you can draw the navel a little bit in, right? But roll those shoulders back and lift your heart. And then we just allow the pelvis to gently sway a little bit from one side to the other. And just observe what kind of sensation that creates in your lower back. Gently turning the pelvis from one side to the other. Keep on pushing your hands down as we come back to center, broaden collarbones. And then as you exhale, let your body wave sit back into your child's pose, knees open wide. 2 more waves like that. Take a deep inhale. On your exhale, let your body wave propel forward. Spread the shoulder blades wide as you round your spine forward. On the inhale, body wave hits the shore, lift your heart. Push the floor away with your hands, and on your next exhale, let your body wave sit back, move back into child's pose. Last time, deep inhale here. Exhale, propel your body wave forward, rounding your spine strongly. Inhale, lift and open your heart. Now come a little bit up in your hips and step your right foot to the outside of your right hand. Your hands can stay on blocks. And now rotate the foot 45 degrees to the side, or just the toes rotate, and have the knee flap open to the side, and maybe the arch of the foot is lifting. And then we just wiggle the hips a little bit, the pelvis. And we see what this does to our body. So we explore the area, our outer hip rotator muscles really. Gentle, playful, and friendly approach. Before you come back to the front, step your right knee back. And then from here, step your left foot to the outside of your left hand and block. Of course, you can also remove the blocks here. It depends how much, what intensity you want to work with, or how far you are in pregnancy and how big the belly is. So the front toes rotate 45 degrees to the side. The knee flaps open. That might lift the inner arch. And then again, just play with a gentle hip sway. So tilting the pelvis a little bit sideways. Just be inquisitive. Again, there are no fixed rules here. Just see what feels interesting to you and valuable. Continue breathing and observe at what rhythm and depth your breath washes through the body. as you come back to center, facing the front. And now from here, you have two choices. Removing the blocks from here. You come either to puppy pose, which is forehead on the floor, reaching through your arms and stacking your hips above your knees. Arms are really extended, elbows including, right? Or, if this is available and feels comfortable at this point, let's do a brief downward facing dog. And you can bend your knees to begin with, so you roll your sit bones higher, reaching through your hands pushing down, rolling the sit bones high, and then just see how far can you straighten those legs without letting this have any effect on your lower back. Inhale, rock forward to plank pose, navel's drawing in, and then bring your knees to the floor, and for a moment, opening the knees wide, rest in child's pose. Might want to wiggle a little bit from one side to the other, sinking down deep. And then from here, come onto your hands and knees. And we're gonna practice pigeon pose now. And for prenatal yoga, you're gonna need a folded blanket, like a roll, maybe two of them even. Really depends on how big your belly is and how open your hips are. So more or less this shape, so this width. And again, you might need two of those. So just see what works for you. And then bring your right ankle to the right, your right knee to the right, right knee goes to the right wrist. And then you sit with your right sit bone on the blanket, and the top of your left thigh is resting on the blanket as well. And again, if your belly is bigger, you will need more support, so you're higher up with the whole thing. So if you need to gather more props, just hit pause and meet back on the mat once you've gathered all your equipment. Now reach through your back toes, reaching through your left toes. Roll the shoulders back, and just know that the stretch gets even more intense the more parallel the front, your front shin is with the front edge of your yoga mat. So just find a comfortable edge to work with. And have your hands in a sort of upward facing, or arms in a sort of upward facing dog shape. Hands are pressing down, roll the shoulders back. And as our hands are pressing down and a little bit forward, we kind of encourage that right hip point to move back. So we make sure that we kind of square the hips with the front edge of the yoga mat. A few deep cycles of breath where you can also release your exhale through your mouth. Allowing your face to soften. And trying again to cultivate a 360-degree view on our body, rather than just recognizing and noticing the most obvious, which is probably your right outer hip at the moment. So try to cultivate a panoramic view in your body where you sense and experience the wholeness of your being, including the breath. And then from here, we lean over to the right side and swing the left leg to the front. And you might want to just stay seated on your blanket, can come comfortable. Right foot goes to the outside of your right knee or maybe calf, really depends on how big the belly is. Hug the knee, lengthen your spine, and open to your left. Into a gentle spinal twist where we concentrate the twist more on the shoulder girdle and the upper spine rather than the lower back. And then come slowly back to center. And then from here, we just swing the right leg far back. changing sides in pigeon pose. So take a moment to make sure that your blanket is in a comfortable place underneath your left sit bone, and also patting the top of your right thigh. Reaching through your right toes. And having your hands a little bit in front of you. Your arms are slightly angled in front of you. A bit like an upward facing dog, I would say. So pressing your hands down and a little bit forward. At the same time encouraging the left hip to move a little bit back. Opening your heart. And whenever you feel a tearing sensation or kind of uncomfortable stretch in your tummy, you either draw the navel a little bit in or you even come a little bit further forward down. So just be inquisitive like always. And make the practice really suit you and your needs and your body, your ever-changing body. Let's have a few more cycles of breath where you can allow the exhale release through your mouth. Cultivating a panoramic view on our body and our present experience. And allowing ourselves to be carried by the breath. And then let's slowly lean over to the left. So you can swing your right leg all the way to the front. And extend your right leg is extended and your left foot comes to the outside of your right knee or the calf, depending again how big the belly is. Then hug the knee, so you upright your spine like so. And keep that right leg relatively engaged with the toes pointing up. Take an inhale here, lengthen the spine, and keep that length as you roll your right shoulder back. And keeping the twist a little bit more out of the lower back. We don't want to disturb the baby being deeper in our belly. So continue breathing here. So make sure that your head doesn't just drop, but the chin stays parallel to the floor. And then come slowly all the way back to the front. For our last pose, we're gonna need a block, or if this is too firm, maybe a folded blanket again, or maybe a few pillows. So what you're gonna do is you're gonna lie shortly on your back and cross your left ankle on your right, over your right ankle with your legs being straight, and then you roll over to the right so you can place that block underneath your left buttocks / sacrum. And if if this is uncomfortable, so maybe try a folded blanket or firm pillow. This is a very mellow twist where you reach your arms out to the sides. And a pose that also provides a little bit more breathing space in the deeper abdomen, where breathing, for obvious reasons, gets a little bit more limited and inhibited. But now with the left side of our body, like lifted, with a block underneath, we might find that we can guide the breath a little bit deeper down towards the pelvic floor. And since this is going to be a really short session, we take this as Shavasana as well. Of course, we're changing sides in a moment, but already allow your mind to really settle even more and gravity to take over. Letting that left shoulder sink down heavily into the floor. And then get slowly out of there, removing the block from underneath. Changing sides, so you take your right ankle on top of your left ankle. Roll over to the left and place the block underneath the right buttocks / sacrum. And again, reaching your arms to the sides. Maybe taking another moment to spread your shoulder blades nicely so both of them can drape down heavily into the floor. Before you give gravity permission to take over. And your mind to settle and rest. As you guide the breath, maybe a little bit more deeply into the right side of your body, including the right side of your abdomen. You might find there's a little bit more opening and breathing space than usual. Let's have another 2 cycles of breath here. Before you slowly roll all the way over to your left side, making yourself small there. You can use your right arm as a pillow if you wish. And now continue rolling into your hands, and with your eyes still being closed, come slowly all the way to a comfortable seat. Where your hands rest on your knees or on your thighs. Crown of your head reaching high. And taking a moment to turn inward. Simply observe how the breath washes through your body. And again, guiding it a little bit deeper down into the abdomen. At least imagine, even if it feels like there's not much breathing space there, still imagine you would send the breath down to your baby. Allowing the face to be relaxed and soft. And then join your palms together in front of your heart. Opening your eyes again next time you exhale. Thanks for practicing. Namaste.